Welcome back to Great Day. Navigating the healthcare system can be confusing for anyone. Our next guest can help seniors in particular find the right doctors and other healthcare workers. They can also help them understand their Medicare benefits. Joining us with details, please welcome Dr. Brienne Loy with Partners in Primary Care. Good morning.
Good morning. Thanks for having me.
As a doctor, you promote anything that can strengthen that doctor-patient relationship, because that really kind of dovetails into better healthcare.
Absolutely. So at Partners in Primary Care, we're really focused on getting to know the patient as a whole and focusing on their whole health system. Partners in Primary Care is a network of clinics nationwide. We're focused on senior-focused care, so we've served over 35,000 Medicare patients nationwide, and are very excited to be coming here to Houston.
Yeah, just like you would have in pediatrics, kind of a different way of dealing with patients, it becomes something different when you're dealing with seniors. I know I went through it with both of my parents, and I saw their health needs change. You recognize from every level how those health needs can change, so your team understands senior aging health challenges as well.
Absolutely. So as patients age, their healthcare problems become more complex. It's not just about their medical problems, but also social problems and mental health problems, and it's a very complex healthcare needs.
Depression is
absolutely. Depression is an issue. So senior focused Partners in Primary Care focuses on seniors in every way, everything that we do. So everything from our facilities to the services to our care team.
Talk about your facilities. I mean, y'all left no stone unturned. Like literally, wider hallways.
I would say absolutely. We have free parking at all of our clinics. Handicap parking right up in the front for all of our patients. The clinics have non-slip floors to help prevent falls. There's wider doorways. There's larger scales to accommodate wheelchairs and walkers. The exam rooms have low exam table chairs, so it's easier for patients to get up and down. There's TVs in each room, so you can see your test results and talk about your care plan with the doctor. One of my favorite things is there's activity centers in every clinic, so patients can come to social events. We've had bingo and ice cream socials.
And that is so important, because sometimes they cocoon themselves and it's kind of like the quality of life disappears, right?
Absolutely. I would say depression's a major issue in older patients, and so it's really important to work on not just their physical health, but mental health and social health. So we partner with people in the community, like Silver Sneakers does exercise classes, Alzheimer's Association comes in. We have education topics like diabetes education, nutrition.
And if somebody can't make it to the clinic, you work that out too.
Absolutely. We always have same-day slots open, and we can get patients in at any time.
Yeah, I know what happened with like my dad. He needed to have like some antibiotic care like weekly, and he was getting in the car, going down there, and then someone said, talk about those partners that you have.
Absolutely.
Wait a minute, we can probably do this at your house. We'll come to you.
Absolutely. So all of our facilities have board certified physicians, but what makes Partners in Primary Care so unique is our care team. So anyone that's involved in the patient's care is part of that care team. What's unique about Partners in Primary Care is we have behavioral health specialists to work on those depression and issues. We have social workers that can help with community resources, like if patients need help with transportation or food resources.
And then even connecting what Medicare, what plan do you have? And
we have care coaches, and the social workers together can help navigate the healthcare system. Patients get discharged from the hospital and they go home with bottles of medicine that they don't know how to take, what's new, what's old. We have nurses that can work with them and help making sure when they get out of the hospital, they know what's going on. We have clinical pharmacists on staff to make sure they're taking their medications correctly. So all of those people together are the care team, and we try to touch all the parts of their health care.
And the thing that you love as a doctor is that the time you get to spend with your patients, you get to spend more time.
Absolutely.
And make sure they clearly understand what they need to do.
Number one thing is seniors want to have time to talk about what's going on with them. They have a lot of healthcare needs, and they want to be able to talk about that, and they want to feel heard. So we have longer visits, and by having this extra support staff, it lets the doctor be able to be the doctor and work on those medical problems, and let that other staff support the doctor and the patient.
Yeah, you have a number of Houston centers. You opened Downtown East and Gulf Gate centers this month. More locations in Houston are coming this year. The Jacinto City Center opens in August, and then of course Pasadena and Baytown. There's grand openings and tours where you get to meet the doctors, ask the questions, see the facilities.
Yeah, we always encourage patients and their families to come by the clinic. You can call to schedule a tour, you can come by, meet the care team, walk through the facility, and make sure that Partners in Primary Care is a good fit for them.
Yeah, and then make your appointments, right?
Absolutely.
All right, to request a tour, visit seniorfocusedhouston.com or call Partners in Primary Care at 832-915-3320, 832-915-3320. I'll see you in a couple of decades. All right.